If someone's thinking about going to therapy, they say, okay, I'm ready to go to therapy. But then they hear this word called prolonged exposure therapy, which has been one of the most effective approaches for treating trauma survivors or people who've been through trauma. Can we break that down? Because it can sound overwhelming or scary for first-time people who are trying to get into therapy.
Yeah, this is something we talk about a lot. And I think what you're flagging is that exact, phenomenon of this like disconnect between the scientific language and then how people think about things. So, whenever I've been in front of a client or a potential client and I'm talking about this is what prolonged exposure is, the overwhelming reaction is like, oh man, I know that's something I need to do, but like I really don't want to because like it's hard. Like it is hard, right? To like confront the thing that you've been actively and intentionally avoiding because it brings you pain, which is that those traumatic memories. But I think that, the way we think about it again is really, if we break down what it actually is, it's working with a trained professional who really understands trauma and trauma recovery to like systematically and carefully in a safe environment start to reprocess or sort of speak out loud or tell the story of your traumatic experiences so that you can sort of release the emotion that's been built up that your brain and body have been holding on to so that your brain can learn I'm safe now. The trauma is no longer happening to me. You can sort of like make some meaning from your experiences. And I don't mean find a silver lining to your trauma, but like, sort of in the process of telling your story, one of the natural effects, and this is really like tapping into the natural way that our body heals from trauma in the absence of therapy, really have an opportunity to make some meaning around what's happened to you, to put it into the larger story of your life, because it is just, one or more chapters of your life. It's not the whole story. I think when you break down what it actually is, it's not that crazy. And I think a lot of people can really relate to this idea of putting things to words in the support of like an empathic and caring person and experience relief and healing from that, whether in a traumatic context or not.